Welcome to the Healthy Body. Dr. Alex here. Today, we're diving into an important and often overlooked topic: the connection between sexual activity, specifically ejaculation frequency, and prostate cancer risk. For decades, researchers have been trying to understand what lifestyle choices may help protect men from prostate cancer. And one surprising area of research suggests that something as natural as frequent sexual activity, whether through sex with a partner or through masturbation, may actually lower the risk. Now, before we get into the details, let me quickly remind you: if you enjoy learning practical, science-backed ways to protect your health and improve your vitality, make sure you subscribe to the Healthy Body. That way, you'll never miss new videos that could make a real difference in your long-term well-being. So let's start with the science. One of the largest and most well-known studies on this subject came from Harvard researchers in 2016. They followed more than 32,000 men over an 18-year period. That's nearly 2 decades of observation. What they found was fascinating. Men who ejaculated more than 20 times per month, so roughly 5 or more times per week, had about a 20% lower risk of developing prostate cancer, compared to men who only ejaculated 4 to 7 times per month. That's a pretty significant difference. To put it in perspective, imagine 2 men in their 40s. One ejaculates maybe once or twice a week, the other about 5 times. According to this research, the man with the more frequent activity could have a meaningful reduction in prostate cancer risk. But why would this be the case? Researchers don't yet have a definitive answer. The leading theory is that ejaculation may help flush out potentially harmful substances from the prostate. The prostate gland produces much of the fluid in semen, and it's thought that frequent release might help clear away toxins or inflammatory agents that could otherwise accumulate and contribute to cancer development. Think of it like cleaning out a coffee filter. If you let grounds and residue sit there too long, buildup occurs. But if you rinse it out regularly, things stay cleaner. In a similar way, the prostate may benefit from regular release. Now, as with many areas of health, things aren't so straightforward. While the Harvard study is very compelling, not all research agrees. Some smaller studies have found no benefit at all, and a few even hinted at the possibility that higher ejaculation frequency could increase risk in certain cases. That inconsistency tells us that there are probably many other factors at play: genetics, diet, physical activity, overall lifestyle, and even the type of prostate cancer being studied. It's also important to note that this apparent protective effect does not seem to apply to the most aggressive, fast-growing forms of prostate cancer. These are the types that are often the most deadly. So while frequent ejaculation may help reduce risk overall, it is not a guarantee, and it is certainly not a cure. Here's the bottom line. What we know right now is that frequent ejaculation is associated with a reduced risk of prostate cancer in some men, but we can't say with certainty that one causes the other. Correlation doesn't always equal causation. It's possible that men who are sexually active more often also lead healthier lives in general. Maybe they exercise more, eat better, or maintain stronger relationships. Any of those factors could play a role in lowering risk. That being said, the good news is this: there's no evidence that frequent ejaculation is harmful. In fact, from a medical standpoint, it's considered safe and normal. And if there may be a protective benefit, that's just an added bonus. Now let's expand this conversation a little further, because prostate health is influenced by much more than sexual activity. Diet, exercise, sleep quality, and stress management all play critical roles. For example, maintaining a diet rich in vegetables, fruits, and healthy fats, like omega-3s from fish or flaxseed, can support prostate health. On the flip side, diets high in processed meats, sugars, and unhealthy fats may increase inflammation and contribute to greater risk. Exercise is also strongly protective. Studies consistently show that men who stay physically active have lower rates of aggressive prostate cancer. Even moderate activities like brisk walking, cycling, or swimming can make a difference. Sleep is another underestimated factor. Poor or irregular sleep has been linked to hormonal imbalances and inflammation, which can affect the prostate as well. Prioritizing restorative rest may be just as important as diet and exercise. And of course, stress. Chronic stress elevates cortisol and other hormones that, over time, may impair immune function and create an environment where cancer can thrive. Stress reduction strategies like meditation, deep breathing, or even spending time in nature can provide meaningful protection. So, while today's topic highlights ejaculation frequency as one possible piece of the puzzle, it's best to think of prostate health as the sum of many interconnected lifestyle factors. At this point in the video, let me pause to remind you. If you're finding this information valuable, make sure to subscribe to The Healthy Body. We release regular content to help you take control of your health, improve energy, and live with vitality, no matter your age. Now, I want to circle back to another common question. Does age matter when it comes to the connection between ejaculation and prostate cancer risk? Interestingly, the Harvard study found the strongest association in men in their 20s and 40s. That suggests early habits may have long-term implications. However, that doesn't mean older men can't benefit. Maintaining sexual health and activity can support not only prostate health, but also cardiovascular, hormonal, and mental health at any age. Another aspect worth discussing is the psychological benefit. Sexual activity and intimacy, whether with a partner or solo, can improve mood, reduce anxiety, and enhance sleep. All of those factors indirectly support immune function and overall resilience against disease. So while the physical flushing of the prostate may be one explanation, the broader mind-body benefits could be just as important. Of course, whenever we talk about cancer prevention, it's important to emphasize screening. Regular prostate exams and appropriate lab tests, such as PSA levels, remain crucial. Even if lifestyle habits reduce risk, they cannot replace medical screening. Detecting prostate cancer early often leads to much better outcomes. So let's put this all together. If you're looking for practical takeaways, here are a few. Maintaining a healthy frequency of ejaculation may provide prostate benefits. Aim for what feels natural and comfortable. There's no need to stress about specific numbers. Support prostate health with a nutrient-rich diet, emphasizing vegetables, fruits, lean proteins, and healthy fats. Stay physically active most days of the week. Prioritize high-quality sleep and consistent sleep patterns. Incorporate stress-reducing practices into your daily routine. Stay on top of screenings and medical checkups, especially as you age. When you think about it, these strategies aren't just about prostate cancer. They're about living a healthier, longer, more vibrant life overall. And that's exactly what The Healthy Body is all about. Helping you make small, sustainable changes that add up to big health benefits. So as we wrap up, remember that while the link between ejaculation and prostate cancer risk is still being studied, the evidence so far suggests there may be a protective effect. Combine that with a healthy lifestyle and regular medical care, and you give yourself the best chance at protecting not just your prostate, but your whole body. If you found today's discussion helpful, I encourage you to subscribe to The Healthy Body. That way you'll stay connected to future videos designed to empower you with practical, science-based tools for lasting health and vitality. Thank you for spending this time with me today. This is Dr. Alex, wishing you continued health, energy, and well-being.